Okay, so I was doing congenital heart disease. The syndrome is one or more abnormalities of the heart, which is a defect. So the structure that you are born with, one of the many most common birth defects, can change the way blood flows through your heart. And with this being said, it could be really difficult to justify it if it is a complex deformability, so therefore it is life-threatening, or one that would hardly cause any problems whatsoever. This disease could mean many things for an individual who has it, because in treatments of babies who have died of this disease often survive good and healthy into adulthood. However, some adults can get symptoms later on in adulthood, as well as those that were treated as an infant. Many of these diseases that congenital heart disease can cause are atrial septal defect, atrioventricular canal defect, bicuspid aortic valve, or aortic of the aorta, tetralogy of Fallot, and etc. There are many more that can cause it, but it is never said to be specific. This is why the disease has no common cure and only treatment, because it can always come back later. Even in later form of life, if treated, there are many symptoms for this disease because it can cause so many defects in many areas, but for some people that they have no symptoms or signs of the disease whatsoever, far more than others. They either get them right away or later on in life. Common symptoms you may have include abnormalities of the heart rhythms. This is also called arrhythmias, as well as a bluish tint to the skin, usually in lips and fingernails. This is known as cyanosis, a shortness of breath, tiring quickly upon being active, or swelling of the tissue and organs. This is known as edema. This disease has no specific known to man cause, but it could have something to do with heredity. Some risk factors could be environmental or genetic. For example, in German measles, rubella, if your mother had it while pregnant, it could have affected your heart development while in the womb, as well as if your mother has diabetes or took medication for it. Even drinking alcohol or smoking are main causes of while having this disease. And usually if your mother is smoking and in the womb is another reason why you could have it. The treatment for this disease can conclude in some medicines or catheter procedures. But many children with congenital heart disease do not require treatment, usually because it depends on the child's age, size, or general health. Many treatments also conclude on how severe it is, but other treatments could be surgery, which is usually to patch a hole in between in the chambers of the heart, or a heart transplant. The medicines usually are for the lowering blood pressure, as well as to control heart rate, and there are also heart devices to help with congenital heart disease.